Good afternoon and welcome to the Overview and Scrutiny Management Committee meeting. We have apologies for absence from Councillor Hussain and Councillor Taylor. Could the committee members please introduce themselves? Councillor Marchington.
Andrew Marchington, Chair of the Children and Young People's Scrutiny Panel.
Councillor Ramsey.
Jackie Ramsey, Chair of Health and Adult Social Care Scrutiny Panel.
And I'm Councillor Liz Mage, Chair of Scrutiny. Minutes of the previous meeting. The minutes are here from the 6th of February and the 7th of March. Does anybody have any comments they wish to raise on the minutes of the meeting? No, we agree them as a true record. Councillor Ramsey?
Just my spelling of my name. It's AY at the end. It's on page 32 in the papers, but page 32 anyway.
It'll be sorted out, thank you. Okay. Right. Does any member of the panel have any interests they wish to declare? No. No, thank you. The meeting is open to the public and being webcast live. All items will be considered in public session. We haven't received any petitions or deputations. No. So the next item is the Scrutiny of Loneliness and Kirklees update, and there is a report in your papers at page 19. So we've been doing some work on loneliness and social isolation, and the scope of the work is laid out at point 2.2. We've held a number of informal and formal sessions to gather evidence. We've looked at the role of the Partnership Loneliness Steering Group, how best to develop local responses to identifying, signposting and referring people who are lonely and isolated, and how loneliness could be made everyone's business, and a discussion on the staff guidance document. We've also engaged with different organisations, Community Plus, the Council's Wellness Service, Love to Meet You, Yorkshire Children's Centre, Age UK, Yorkshire Children's Centre, the Carers Trust, Mid Yorkshire and Carers Count, to name but a few, and visited the following groups: the Long COVID Support Group at Batley Town Hall, the Young Onset Dementia Support Group, Carers Count at 2 locations in North and South Kirklees, and the Carers Trust Listening Group. The report is here to ask if we will give consideration to the terms of reference and decide what additional work we wish to undertake, if any, prior to giving consideration to recommendations. And it's hoped that an outcomes report will be submitted to the committee in the early part of the next municipal year. Does anybody have any points they wish to raise on this item? Councillor Ramsey.
Thank you very much, Chair. I think that the work is coming together nicely. The comment I would make is around looking at the national and local research that we did about where loneliness really has an impact, and certainly it sprang out to me around the concerns around 16 to 24-year-olds, but also those areas where they're more deprived. And I'm just trying to work through whether or not we feel as though we've covered those as specific target areas to understand what we can do to support them.
Councillor Marchington, have you got any comments?
Yeah, I think we've talked to you, might make a point about young people's voice. And I think I've probably said at committee before about the Young People's Partnership and the Year 9 survey, and actually I think there's some work going on about it, particularly enabling young boys and young men to better articulate their well-being, because they seem to disproportionately express feeling well when that doesn't bear out with the evidence. And I think that I would like to see some link to that. So can be some work done in schools to equip young people to be able to talk about their own well-being more effectively, and that might lead into what is loneliness, when is loneliness and isolation an issue, and they ought to be seeking further help about it. And actually, when is just being on your own an acceptable part of everyday life. So hopefully we can make some links with that.
Thank you. I would agree, we definitely need the young person's voice in this work, absolutely, and the targeted and deprived areas. Also, we've had an offer for a questionnaire to go out to carers as well, and to talk about loneliness and social isolation with carers. With one particular organisation, haven't we, that have made that offer, and some questions have been put together for them to talk through with people about loneliness and social isolation. So that will give us a perspective on that, but we do absolutely need some more work on the young person's voice. Yeah, we do absolutely. So what we'll do is we will look at that. I would like to say thank you to all the groups that we've either visited or talked to in this piece of work so far. We will be putting that outcomes report together with some recommendations, but first we will look at this young person's voice and make sure that is in view in this piece of work. Okay, all right. I also need to apologise that we were to have another item on the agenda today, but unfortunately that could not come to the meeting. So we will move on to lead members' updates. Councillor Marchington.
Yeah, as written, just again express our thanks to Paul White, who's retired. He's 4 years on the panel, and really appreciate the contribution he's made over the years, and thank you. Just the ongoing concern about child protection teams and recruitment. There's some really good work going on about making sure that those people who might have an interest or capacity to become a children's social worker are encouraged to do that, and that's really positive. But it's against the background of difficulties of recruitment, and all children are being kept safe at the moment, but there might well become a point where it's becoming more and more difficult to achieve that, and we need to make sure that measures have been taken.
Thank you. Anybody have any questions or points to raise on this report? I just had something on the emotional wellbeing and mental health provision for children and young people. The report is really good and gives a really good flavour of the work that is being undertaken by the panel. On the emotional wellbeing and health provision, I thought it was interesting that there's been rising demand for all mental health, learning disability and autism services. And I just wondered what work you were looking at in the future to sort of look into that. Are you hoping to look into that in more detail, or will you be looking for reports to come forward? Because you're saying the report introduced proposed developments for services and gave the current waiting list for each service area. So I take it that will be an ongoing process for the panel.
Yes, it is. Yeah.
Thank you. We will move then to Councillor Ramsey and the health and adult social care.
Thank you very much, Chair. I should start as well by thanking the panel from this year, and particularly Leslie Warner, who's stepping down as a councillor this time. So thank her for her contribution and enthusiastic and regular attendance. I think that the things that I'd like to highlight to yourself are we understand the context in which health and social care is being delivered. There isn't sufficient resource in financial terms for pretty much all of the organisations that we've met this year, and there is certainly a concern around workforce with recruitment and retention issues across the board. Some of it relates, certainly particularly within adult social care, to the funding available to pay staff. You know, because it's people can get jobs in retail, etc., that have got much less demanding roles than they have in carers, as being paid carers. So put all that into kind of context, we can see across the board, unfortunately, that we are at times inefficient. That's health and social care. That's locally, and I'm generalising that we have seen some areas of good practice, and we certainly have seen some staff that are working extremely hard and are caring within the time. But we are unable to provide or people are not able to be seen at the right time by the right person in the right place. So we've got inefficient and sometimes poor quality care, and we just need to be aware of that and to do everything that we can to try and mitigate that. I do feel there are a couple of issues that are specific that I'd like to raise. One is we are no further forward with the maternity services, the birth centres at Huddersfield and at Dewsbury. Both have been closed now for some time. Dewsbury's closed last year, and CHFT's, the one at Huddersfield, closed in March 2020. We're on our second letter to the chief executives to see what the plan is, and we understand absolutely that they cannot deliver unsafe maternity care. So, you know, that's it. But it's unfortunate that we've had to write twice to get an action plan and a timeline and to get some kind of real understanding as to what's going to happen. So we're waiting the outcome of that letter. We haven't had a response yet, so we'll wait and see. The other thing is something that's a little bit more newer to us, in that at our last meeting we looked at dentistry, which is coming back into from NHS England's commissioning through into the integrated care board commissioning. And without a doubt, there are real issues in dentistry. One specific issue that we've again written to chief execs about and to the integrated care board is for children with who are unable to have teeth extractions under general anaesthetic. We have got a waiting list that has been building of over 2 years with about 1,500 plus children on it, and this is not what we would consider to be good quality care. Again, we've written, but we've not had a response to that. But those children, without a doubt, are either in pain or having repeated infections, but they're not getting the best quality service that we would want. So just a couple of things. I perhaps could ask you, you know, from an experience point of view, if we don't get anywhere, so if people don't respond to us when we've written as a scrutiny, where is the teeth to scrutiny? What do we then do? And I recognise it's really difficult when we're scrutinising a range of partner services.
There is a in the local government acts, there are a requirement for the health partners to come to scrutiny and to provide information that is required by scrutiny. And therefore, it previously in the past, I have known, and it was actually a regional scrutiny panel wrote with the information that is in the regulations to say that they required the information or the person to attend the meeting. And I think certainly, obviously the panel needs to consider the length of time that it thinks is appropriate for the wait, but then it needs to consider whether there is, whether this is no longer temporary change in service, and whether this is a actual substantial change in service or not. And if a panel says that, for instance, for maternity, if there is a substantial change in service, then that brings in other regulations that need to be followed. in order for a health committee to be able to scrutinise what it considers to be a substantial change in service.
Thank you. Well, we will persevere and see if the additional support that you've or additional advice that you've given us makes a difference.
I do think that there needs to be a timeline when the panels say, right, okay, we've given you long enough, and certainly that you've written twice now to for the maternity information to ask if there is a plan in place, and I absolutely agree they can't run unsafe maternity. They absolutely can't do that, but we are asking for a plan to how they're going to operate the maternity services going forward, aren't we? And no birthing centres in Kirklees. If that is not a temporary situation, it is, how long is it? The panel needs to decide how long is it before it actually is a permanent thing.
Thank you very much. Thank you.
And the dentistry, let us hope that the change in the dentistry with the West Yorkshire Integrated Care Board, they can sort out the 2-year waiting list for extractions, because that must be awful for youngsters to have to wait that length of time, and the impact it has on their lives when they're in pain from needing extractions for teeth. It cannot be underestimated, can it? And it needs to be addressed, doesn't it? Yeah. Are there any other points on that report? Okay, thank you. We move then to the work programme and I look forward to 2023. So the work programme is here in the papers at page 35. So we've had the leaders' priorities in July 2022 and he came back in 2023, and we look forward to the leaders of the council coming again. It is penciled in for the 1st of August for the leader of the council to come and talk to OSMC about his priorities going forward, or should I say the leaders' priorities going forward. Inclusion and diversity, that came to a meeting. Go on, Councillor Matchington.
Can I just suggest that, I think we've said it before, 1st of August, panels are preparing their work programmes in June, immediately after the elections. We know that political parties are fighting elections on a platform at the moment. It would be really useful to have the councils, the leaders' priorities earlier than the 1st of August, just to enable panels. I know some situations are ongoing, but if there's anything key priorities from the any new administration, we can see that early on.
We will endeavour to try and get that information a lot sooner, Councillor Matchington. Inclusion and diversity, that we've covered, and that is an ongoing item. Inclusive communities, we've covered that. The council plan, we're looking forward to that coming early in the new municipal year. Domestic abuse strategy, we've covered. Corporate safeguarding. The local flood risk management, that's annual report, so that will be coming again. And the ad hoc scrutiny panel for housing stock. Now that has completed its work as that ad hoc. So
you've got an update report on that.
Yeah, so there's an update report coming at a particular point in time in the next municipal year. Okay. And overview of scrutiny, that probably could go to a different panel that's covering housing at that time. Okay. Overview of scrutiny work programmes. Armed Forces Covenant should have come today, but unfortunately couldn't. Voluntary community sectors we've covered. Social isolation and loneliness we've talked about. grant funding we've covered, and regional working. Hopefully, we'll be able to hear more about regional working in the new year, in the municipal year, and hopefully the leader will be able to give us more information on the priorities as far as regional working is concerned. Primary care networks and health improvement, we had that at the 7th of March meeting, and it was discussed at corporate governance and audit as well. Are there any other points?
Just from the point of view of how the primary care networks are actually working in practice, we've also covered that in health and adult social care, and have agreed that we will relook at that. So we're expecting that to perhaps come back to us.
Yeah, it will drop off OSMC's work programme and be on the health and social care work programme, will that. We will be looking at, when we have the workshop on the 6th of June, to look at the work programme for OSMC going forward. I think there will be a clearer idea, hopefully then, of items that are coming forward in the new municipal year, and which panels they will be sitting with. Okay. Are there any other points on that item? No? Okay then. Can I say thank you to members, lead members, scrutiny lead members, for all the work they've put in over the past municipal year. Thank you very much for that. Thank you to all the panels, and thank you to all the co-optees who've participated and who play a very valuable role in the work of Scrutiny. I don't have any other business, so if that is all we have, we will close the meeting. Thank you. Thank you.